Hello, thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As you know, we are talking about COVID-19, the pandemic, the way it has affected the world, the way it has affected us in Guyana. As usual, I'm wearing my mask to cover both my nose and mouth, which is the correct way to wear masks. And I will take this off now using the straps since I'm alone while doing this recording. Remember, if you have any questions or comments regarding the COVID-19 pandemic, please feel free to send a WhatsApp message to 620-6275, or you can send an email to docandcovid@gmail.com. We continue discussing the COVID-19 pandemic, how it has affected us, how it has affected the world. And one of the biggest ways in which it has affected everyone, apart from the disruption of your lives and our daily activities, it has revealed significant bad outcomes in persons with heart disease, that is, persons with underlying heart disease. Not only has it produced bad outcomes in people who have underlying heart disease, COVID-19 itself can cause heart disease. Let me repeat that. COVID-19 can cause heart disease. It can cause heart disease in early stages, and we are finding out that late stages of COVID or long COVID can also be associated with significant heart disease. So it's an important thing to know the effects that this virus can have on the heart and the cardiovascular system in general, and to be able to recognize the signs or the symptoms when this is developing in COVID-19 patients. So the main effects of COVID on the heart directly can be thought of in three categories. The effects of COVID on the heart muscle, the effects of COVID on the heart rhythm, and the effects of COVID on the blood flow. And let me talk a little bit about the muscle. The heart is a muscular structure, and that special muscle is responsible for contracting and pumping blood all across the body. So when there's a problem with the muscle, then the heart cannot contract as strongly as we need it to, and therefore blood will not be pumped to the rest of the body as needed. And so you may find, as people try to exercise or they try to go about their normal activities, the amount of blood that they need to be pumped to their muscles and the legs, to the brain, etc., cannot be met by the strength of the muscle of the heart that is responsible for pumping the blood, because the muscle becomes weak. The other main thing that happens is a disruption in the heart rhythm. From a nice regular rhythm with a rate of between 60 to 100 beats per minute, the heart rate can be a lot faster, and the rhythm can move from regular to irregular and develop things that something we refer to as atrial fibrillation and other extra beats that can occur both in the top part of the heart as well as the bottom part of the heart. The blood flow aspect of this is very important because it can present and cause people to have symptoms that are very similar to a heart attack, and it can actually cause heart attack. Because for the muscles of the heart to work properly, they need their own blood supply. And so some arteries that run on the surface of the heart is responsible for taking that blood to the muscles of the heart. And if there's blockages and clots that are formed in these arteries, then the blood cannot reach to the muscles of the heart, and you can have what is known as a heart attack or myocardial infarction. So it is important to recognize all of the common ways in which COVID-19 can affect the heart. Why is heart disease such an important thing to be aware of? Well, it is still the number one killer. The number one killer across the world is heart disease. Over 400 million men and women have some kind of cardiovascular illness. And 1/3 of all deaths globally, that's 1/3 of all deaths that occur in the world, are as a result of heart disease and stroke. 18 million people across the world have died and are dying yearly from heart disease. And that's a very staggering statistic. And it reminds us that what is true for the rest of the world is also true for Guyana. Heart disease is our number one cause of death, as it is across the world. So here it is that we have already a problem with heart disease being the number one cause of death. And now we're adding COVID, which can also cause heart disease. So it is no surprise that we have been seeing an increase in the number of heart disease patients who are coming into hospital and presenting to clinics. So the risk factors for developing heart disease in general are quite well known. These are things like advanced age, high blood pressure or hypertension, obesity or overweight, diabetes mellitus, and of course, pre-existing cardiovascular disease. What COVID-19 does, that it causes an abnormal regulation in the systems that keep your cardiovascular status in place. So it affects your immune system. It can cause damage to the inflammatory process in the body and also the fibrin system, which is responsible for clotting. The dysfunction in the heart are several, and it can be classified as in various ways, but the number one way to look at this is a mismatch between the supply and demand. So you need more blood, you need more contraction from the heart, but because it is in a weakened state, it cannot meet that demand. Acute coronary syndrome is also one of the ways we use to describe a heart attack or blockage in the heart that can cause heart muscle damage. We can also have inflammation of the heart muscle and the lining around the heart as well. Heart rhythm problems can arise. And the commonest heart rhythm problems due to COVID-19 are things that are known as atrial fibrillation, where the top part of the heart beats rather fast and irregularly. And the other thing is that there is an increase in the resting heart rate among people who are COVID-19 positive. It is important to note that people who have a fever generally can have an increased heart rate. For each degree rise in temperature, that's in centigrade, the resting heart rate is estimated to rise by about 10 beats per minute as well. As you may know, the normal heart rate is between 60 to 100 beats, and most people in a fairly decent health would have a resting heart rate about 70 to 80 beats per minute. And so if it falls below the 60 beats per minute, it can cause certain symptoms. And if it goes above 100 beats per minute, that can also cause certain symptoms. So if it goes below 60, the things to worry about and to look out for is like dizziness or fainting, or in Guyana we call lightheadedness, and sometimes blackout. And if it goes above 100, some people may have what is called palpitations. You feel your heart racing away. And that also can be associated with like increased sweating. It can be increased with dizziness. It can be associated with lightheadedness. So a fast heart rate as well as a low heart rate can both produce symptoms that are very concerning to people. The other main way in which this can affect your heart is by causing heart failure. Now, heart failure is if your heart is not pumping sufficient blood to go around the body. When that happens, the blood then builds up in the lungs and people become short of breath and they cannot lie flat in bed, and sometimes their legs get swollen as well. And the tummy also gets swollen and people feel bloated. Now, one of the things that we see that COVID does to the vascular system, that is your blood vessel, is that it causes things like deep vein thrombosis. It can cause pulmonary embolism as well as more thrombus or clots forming in the small blood vessels. Now, this is an important part of the discussion that we should recognize, because recently, as we have been rolling out vaccines all across the international media, there has been an increased interest in blood clots, and people were trying to associate the use of vaccines with blood clots. Well, here it is that we have the science that tells us that even before vaccines were developed, COVID-19 itself causes increased blood clots. Deep vein thrombosis, basically that means that in the veins, especially in the legs, the big veins in the legs can have clots forming. Thrombosis or thrombus is a clot. So when you say that COVID-19 is associated with deep vein thrombosis, what you're saying is that COVID-19 itself can cause clots in the veins of the legs. Pulmonary embolism is the other thing. A pulmonary embolism, in this case, it really means that that clot would have moved away from the leg and gone into the lungs. And when it gets there, it causes severe chest pain and shortness of breath. Again, it's a problem where a piece of clot breaks off and gets into the lungs. And this is before we even start talking about vaccines. So when the vaccines came out, people wanted to see an association, or they thought they saw an association between clots and the use of the vaccine. And let me put it to you this way. Even without COVID, even without vaccine, the general incidence of clots is about 100 persons in every 100,000 population. 100 in every 100,000 population. Across Europe, they gave out 17 million AstraZeneca vaccines. 17 million. And they found in that 17 million, there were 22 reported cases of clots in the legs, which is way less than the general population and definitely less than persons who are COVID-19 without vaccine. So that initial reaction has turned out to be a false alarm, and all of the regulatory bodies so far have issued statements to counteract that belief that COVID-19 vaccines are associated with clots. The World Health Organization and the European Medical Association have both said that there are no linkages, there are no associations between the use of the COVID-19 vaccine from AstraZeneca and blood clots. So that's important for us to know, that's important for us to remember, because many of our population have become concerned about potential side effects from using these vaccines. So I hope that this would have shed some light on the heart as it relates to COVID-19, and towards the end we talked about clotting as a potential issue with COVID-19 vaccine, and we say that that has been disproven. It is not true, it is false. Thank you very much for joining me once again. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again.